Look, if we were serious in this country about introducing innovative models of care in healthcare, these things can't just happen in isolation. They need to integrate with the rest of the existing healthcare ecosystem. What does that even mean, anyway? We've got this myriad of stakeholders in healthcare: patients, providers, payers, policymakers. And if we're all running our own race, fueled by our own self-centered motivations and incentives, we're not going to get very far. Providers need to juggle patient needs with running their own small business. Employers want to have a healthy and happy workforce. Investors in technology want a good return on investment. Insurers want to maximise premiums and reduce claims. Politicians want to serve the people and get re-elected. And patients just want happiness and health. Telehealth brings some potential solutions for all these stakeholders, but also probably just as many complex challenges. So what's the role of telehealth in this complex ecosystem of healthcare? How can it transition from an emergency response tool to a staple of modern healthcare delivery? And how can employers leverage innovative telehealth solutions to provide tangible benefits to their employees? Well, with me today is Greg Lewin, Head of Creative Communications and Partnerships at Updoc. And in this episode, we talk about the nuts and bolts of providing on-demand telehealth through AI and process optimization, the rising trend of employers adopting telehealth services as part of their employee benefit strategy, and some unique ways on how to fund virtual models of care, which could ultimately improve access for all Australians to quality healthcare services. Collaboration starts with a conversation, Team HealthTech. Let's make it happen.
Welcome to Talking HealthTech, featuring content and community about technology and healthcare. We acknowledge the traditional owners of lands these conversations were recorded and pay respect to elders past and present.
It's great to be here in the office of Updoc here in Sydney. So thank you very much for having me here in the studio, let's say. But firstly, can you introduce yourself? Tell us a little bit more about you firstly and what you do here at Updoc.
Yeah, nice one, Pete. And yeah, as well, just want to say before I talk about myself and Updoc, obviously everything you're doing with Talking HealthTech is really great. I think, obviously your listeners know this and your viewership knows this, and I think it's really important to kind of continue improving accessibility to kind of the emerging health tech information that's coming out in the industry, and I think no one does it better than you. So
it's a good way to start an interview with compliments. So that's I appreciate that. Thank you.
But yeah, so I guess tend to not talk too much about myself, but so originally Updoc, I guess I'll give a bit of a preface to everything. So originally Updoc was started by Dylan and Cliff, so Dylan Coyne, Cliff Hodgkinson, and then not long after I jumped on board as number one for the team. And originally things were kind of started around it's kind of a story that we talked to a little bit with Dylan, where he kind of had an injury with his elbow. He needed to eventually kind of get surgery on his elbow, but his navigation of different health services, like having to go to 5, 6, 7 different kind of clinics, areas, things to sort out what's going on, for him was a nightmare, and it took so long. And by that point, it was like potentially causing more harm and nerve damage and things like that to his elbow. And so the idea formed originally by the two, Dylan and Cliff, where they thought, how do we increase that accessibility to different areas of healthcare and make it easier for people to navigate? And so I came on board after things were started. We kind of had this conversation around it being really important to make sure that we're kind of communicating properly with people. As you'd be aware, and as your listeners would be aware, health information, communication, something that historically has been so complex to navigate. It still is complex to navigate to some extent, a lot of legacy systems and things like that. And so I originally came on board kind of around, multifaceted communications, creative, a lot of advertising that we do through me as well, and then working towards kind of building partnerships and things like that as well. And so, so originally we had that accessibility angle that we wanted to focus on, and that's still to this day, 3 years later, a really core pillar for us is making sure we improve that accessibility across Australia. We like to think we're doing a pretty good job. I think the recent number for us is that we have provided service to around 95% of postcodes in Australia, which, you look at Telstra, for example, and I think their coverage is like 98.8% or something, 99%. We're not far off that. Like obviously, that final 5% is always going to be the hardest, but we genuinely are trying to get access to everybody in Australia.
Yeah. And so, you've set the scene nicely there in terms of how important this communication piece is to ensure good quality access to healthcare across Australia. Tell me a little bit more about those services that Updoc provides.
Yeah, exactly. So to give a preface again, so we are what we refer to as a kind of a technology platform that facilitates interactions between patients and their practitioners. And so we see that angle as being really important because we're able to kind of take a step back and just focus purely on the kind of the platform and the product and technology itself and leave the kind of clinical work, the health advice, the health information, etc., to the practitioners themselves. Like we tend to stay as far away from that as possible. And so what that enables us to do, so to answer directly the question, I mean, we provide general consultations for a range of different needs, so prescriptions, new and repeat, general medical advice, medical certificates, referrals, so specialist referrals, radiology and imaging, etc. Alternative medicine, previously referred to as plant medicine, and things like weight loss management conversations as well. For the most part, we're medication agnostic. So somewhat as opposed to some other kind of companies in the market, we're medication agnostic. Like we don't it doesn't dictate our decision making around medication that's available. So that lets us really focus on the consultation quality and kind of user experience of the platform. We believe, I mean, different beliefs from different companies, but yeah, so that's what we can provide. We provide those different services. The point around the technology and the platform that we have built, what it enables us is kind of this, to some extent, like replicability of infrastructure and the tech infrastructure that is. And so if we see kind of a user demand for a particular service or offering, we can pretty quickly, using our existing infrastructure, kind of duplicate that for another service stream. We reach out to either existing practitioners or our practitioner pool, the wider pool, and see if they can offer a particular service. So, for example, one that we're looking into at the moment, which is, as you're probably aware, in high demand across Australia, is psychiatry services. And so massive wait times for people to get into psychiatrists, multiple months to get in, 3-6 months. So that's been a high demand through the platform, which we haven't been able to facilitate directly. We can facilitate referrals, but we want to kind of tap into that as well because we think that's really important. So
yeah, and so help me picture it a bit more. So because you mentioned speaking to those different stakeholders and making it easier for people to access different types of healthcare services, and you pointed out that you're focusing on that platform itself, so that there's a pool of practitioners and you're facilitating that connection. How does the average punter on the street kind of come across? Do they, is it branding that you do out and about the Updoc brand, or is it stuff that's kind of, because there's some software platforms that patients might not see? How does that whole interplay kind of work?
Yeah, really, really good question. So it's a mix is the answer. So, originally it was very intent driven. Google type of searches and things like that, looking for services. And it still is a lot of that. Like people are looking for health services because they cannot get access to a lot of health services, right? So that drives a large portion of it. But over time, there has been a kind of an increased push to multiple channels. So obviously brand awareness is starting to become more important for us. It hasn't been a major focus for us historically, and that's almost by design. So to explain that a little bit further, so we do some things internally where we sort of almost challenge ourselves to. We do it in a way, we design it so that we make the product better. But so one of those things is we would argue that we undersell our service. Maybe everyone says that, but we think we do, and that's so that we actually make the product better. We make the service better, we make the platform better, so then it speaks for itself. So, and just to give you an example of that, right? So we, one of our main offerings, our core offerings, is what we refer to as Updoc Pro, which is a kind of an unlimited consultation offering per month. So quite literally, for a small amount, you can access unlimited consultations through Updoc every month. That's just unprecedented. It's not offered in the market anywhere else. And, we talk to a number of different stakeholders, and whenever we talk to them, they're kind of surprised. They're like, how do you offer that? And it's bit of a secret sauce, but, we find that that's something that people really value. It's really valuable for chronic condition sufferers as well, people who are needing consistent access. It's important for an aging population as well, people who need that ongoing access to things like prescriptions and whatever as well, as that increases with age. But yeah, we find that that's really valuable. And then obviously to other channels as well. So, one we're starting to push for is, and this has been kind of the past year a little bit, is for employers. So this one for us originally, like, such a no-brainer. Like, when you look at the offerings for a range of different companies is, some offerings are great at some companies. But some companies, it's either really expensive and inaccessible. So, for example, it might be private health insurance for employees, which can be super expensive and often inaccessible. Like, you're often not able to access much through that. And maybe it's extras cover or something like that, which for the average punter isn't much. Whereas most people are using or accessing a health service, a GP clinic or a medical practitioner clinic, up to 10 times a year. And so if you're an average employee, you're able to access that. The value speaks for itself for the most part. And as well for employers, there's a lot of value for them as well. Like, if you think of a very typical use case for us for larger companies that we work with, is take somebody who falls ill, it's middle of the week, it's, lunchtime, they're feeling a bit unwell, whatever it is, they feel like sickness is coming on of some sort, they probably need antibiotics, whatever it might be. They are, through Updoc, able to get on-demand access, which we can talk about a little bit more about that as well. Majority of those consultations taking place within an hour. They can get that consultation if a script is required. If it's not required, there's other recommendations for other practitioners, but if they require a script, that's sent to them. They can go to a local pharmacy, that afternoon, get their medication, be taking that, multiple times into the evening already. And maybe they're already better to, work from home the next day or something like that. Alternate situation is if they don't have that access, they're trying to get a doctor's appointment, can't get a doctor's appointment that afternoon usually. Maybe they can get one the next day. They're paying probably privately billing, which is often quite expensive through traditional means. And then, maybe they're not even better for another day after that. So, as an employer at scale, you lose 2 days per employee. That's massive, right? So, yeah.
It's interesting that, you're exploring these different models of care or modalities of providing services, and ones that, we've seen a little bit in other parts of the world too. You brought up the example of, it's like a subscription service, the pro example that you gave, and employer-funded levels of care. And so some of these things kind of happen in the US for different reasons. And as the landscape's kind of changed in Australia, it's interesting seeing these different models being adopted here as well. And touching on the point that you raised too around on-demand care, I'd love to learn a little bit more about how you see that kind of landscape shifting in terms of models of care and why something like on-demand care would be so important.
Yeah, it's a really important conversation, I think, generally to be having, with us and the broader landscape. I think, just to give you a picture of us first. So what we see as on-demand care, I mean, it's all relative. It depends on the context of care, right? So, if you're a rural individual and you can't get an appointment for 2 weeks or more, even if it's the next day, that's great for you. That's to some extent more on demand than someone in a metro area. But for us, we have this kind of metric internally that we refer to as the magic rate. It's arbitrary, but it's consultations taking place in under an hour from kind of the request being submitted into the system, information being provided to a practitioner calling you. And so the majority of our consultations take place within an hour at this point in time, which we're super stoked with. We are always improving, though, to try to get that even lower. Our next hurdle would be 30 minutes. And that's genuinely trying to achieve that as well. It's not just, marketing as such. And then we don't even market that. We don't even market within an hour, really. It's not something that we super push. And, there are people who are able to get access within minutes, sometimes within 1 to 2 minutes as well, depending on the day. So that's really what our focus is in that regard. And to kind of paint a bit of our picture as well, we have an international presence as well, small international presence in Europe, not a major focus, but we're kind of slowly understanding the landscape there and introducing ourselves there. And for example, myself and Cliff were in London last year, the year before as well, looking into a few different things there. And, for example, if we think of, I think we were reading a report at the time and talking to a few different practitioners, but when we look at ambulance services in the UK, for example, and just the NHS generally is for a lot of people a nightmare to navigate, but ambulance services were getting to a point, and it's probably worse now, I don't know, but where they were queuing up at the emergency department, right? Like you're getting ambulances queuing with people who are either severely injured, really bad injury, chronic illness, whatever it might be. And it's like, I can't remember the exact metrics, but every minute that you're waiting, it's like the number of life years lost for people is enormous. So, and it's in a whole ecosystem, right? So the reason why I give that example is, the way we think about it is often, and this is in Australia, this is in other environments as well, is like, and this is an example, is like we're talking to hospitals at the moment around integrating into kind of emergency departments and things like that to increase the triaging abilities. So sometimes there's people, a lot of times there are people who are presenting in these locations because they just can't get in anywhere else. So they just go to emergency departments. It could be for something like maybe they have an antibiotic infection or something, a bacterial infection, and they need an antibiotic of some sort, but they just can't, they literally can't get an appointment. They're so sick. So they go there. Whereas if you can do more functional triaging through like a telehealth integrated service, somebody can get an on-demand consultation, they can get their script, they can go to the pharmacy at the hospital or nearby, and then they don't need to clog up the emergency department. And so you can free up systems like that, and then maybe there's like, alleviated burden on those systems. So that's both private and public. Like we see ourselves as complementary to the public system as well. Like
Yeah, interesting. There's a few different use cases there that I could see that would be quite impactful. I'm interested to understand a little bit more how you, like those practitioners that you're engaging and that say a patient might speak to, how do you engage with them? And you mentioned that there's not an expectation or a KPI necessarily, but you've got this pretty quick turnaround. How do you go about ensuring you've got that right kind of pool of clinicians, practitioners to be able to service that patient demand?
It's a great question. It's an ongoing challenge. It's probably, like when you think of at a core level, like our offering is to some extent a marketplace, right? Like it's a two-way marketplace where you're handling patient demand and you're handling practitioner supply, right? So at a simple level. And so that is a balancing act that is always ongoing, right? And so we have, over time, like we've really, really refined our process for developing that out. And we have a really, really close relationship with the partner practitioners. So, to us, they're not just a number to solve consultations. Like, they're a well-educated population who have incredible skill sets and are very important to contribute to the well-being of society in Australia and the world, right? So it may be one of the most important populations there is, you would argue. And so with that in mind, like we take the approach of a very high-touch relationship with them. We have a range of different funnels to bring practitioners onto the platform. We would say that we're quite selective. So like and that's meaning from the point of view of just quality assurance, like quality assurance and vision alignment with the platform. So, there's some practitioners who are just wanting to dip their feet and kind of get an idea of it because they've heard about it. Maybe they've known other practitioners who've been doing it. But we also get a lot of practitioners who, wanting to do this as a genuinely a part-time gig. Some practitioners wanting to do it somewhat full-time as well, and for good reason, right? Like it's highly flexible. You can do it from effectively anywhere in Australia. If you have a computer and a good internet connection, a good audio, right? Like it's pretty great in that regard. And people who maybe it's mothers who are returning to the workforce who were practitioners previously, or people with young kids generally. Like that's a huge practitioner base as well, which we find is really great. That's just increasing accessibility to the workforce as well, right? And so which is something that as we'd both be aware is going to be a problem and is going to continue to be a problem into the future. I think there's different reports that have been released, but the Deloitte report on shortages I think by 2032 of like 10,000 GPs shortage, right, and nurses shortage as well is a challenge that we all have to try to solve. And I think increasing that, like tapping into the existing skill sets that we have and enabling people to use those skill sets, I think is one way to try to solve that.
Yeah. So it sounds like there's a few kind of key pillars or things that are important to the people that work here at Updoc. You've got that focus around the quality assurance side and the good practitioner base, which relationships are really important, and the communication side, which is, where you're coming from to engage the different stakeholders within healthcare. Yep. There's all the partnerships and elements to, and the technical capability. Talk to me a little bit. Well, I can see a lot of them walking around on the floor here, but tell me a little bit more about the people that are working here at Updoc as part of the team.
Yeah. So what can I say and where can I start? I mean, so my background, I have a psychology background previously. I worked in, Big Four consulting previously as well, did behavioral science consulting, have a film background myself as well. And, I've worked at a bunch of different places, but quite genuinely, I think I've never worked at a more switched on place in my life. Everybody here we're super hand selective with the team that we bring on. We, interview hundreds of people arguably for every position, and we then take the approach of, and this is credit to Cliff and Dylan for building such a super team, but we take the approach of everyone has the capability to somewhat be a generalist. We don't see anybody as being, we don't pigeonhole anybody into a particular skill set. Everybody's smart, everybody has the capability. And so we build a team of generalists. I would say almost everybody in the team has some understanding of code, right? Even if that's, low-level Python understanding or understanding Zapier logic or whatever it might be. So, that's really important for the team. And then, people's ability to understand how to communicate effectively to practitioners and to the users of the platform is really key as well. And, we foster the team's growth over time. We do a bunch of your typical kind of company culture things as well, which is really cool. I think we've been posting a little bit more on LinkedIn about that. We typically haven't done that historically, but we've been posting a little bit more. And, we're as you would know, we're always hiring. We're always looking for engineers. We're always looking for product people. That's something that's really key for us. But, we spend time making sure we've got the right people, and we think when they're aligned, it's honestly the best place. We have minimum turnover of team members. Most people have been here for the lifetime that they've been here, they haven't left. So yeah,
interesting. Yeah. And so you've got that capability and the growing, customer base or the user base of the platform and those relationships with the different stakeholders. There's opportunity, I would imagine, with this platform. You touched on it already with a bit of a presence in Europe too. These are challenges that are faced not just here in Australia but globally too, right? There's global opportunities with what you're doing as well.
Massively, yeah. I think our focus is on Australia for sure at the moment. I think Australia is it's an underappreciated ecosystem, in my opinion. I think there's such a huge opportunity to kind of grow the team and the company here and have quite a positive impact, across Australia. To my point around the UK, I think we have a really strong opportunity over the next kind of 10 to 15 years to make sure that we're ahead of the curve in Australia. And that's, through positive regulation, we think is really important. We're absolutely in agreement with that type of regulation, making sure that there's, strong boundaries for care and without hindering innovation in the process. And those sort of things we think are really key. And we don't see any reason why, we're in the UK, in the UK and looking to other European areas as well. The US maybe, even New Zealand, we're not there. That's a small market, but they need help there as well. And with the approach that we've taken, with the we're a platform, right? We're a technology platform. So that's pretty. Obviously there's different markets, different regulation, different kind of challenges across markets, but for a lot of it, 60% of it, you can take that technology and somewhat replicate it across markets, which means a lot for scale, right? You can pretty quickly scale that up and just change the processes and upscale that across the board, which is great. So.
Yeah. No, that sounds exciting. So, you've touched on this conversation already. There's potential to open up into other areas of healthcare, and there's potential other markets too. There's a lot of places you could go. Where are your priorities going to be at over the next kind of 6, 12, 24 as you continue to grow with Updoc?
Yeah. It's a good point to finish off on, I think. Look, there is a lot of opportunity. I think there is so much to be done, as, Canva might say. We're only 1% of the way there. So I think we'll probably continue to just be 1% of the way there as they are. But I think, allied health is really, really critical for us. I think that's an area of interest as I mentioned, kind of psychiatry, psychology as an interest area. Not a priority, but it's an interest area. And, we have kind of worked with a number of different partners previously, and people can access mental health treatment plans through the platform as well, which is one that I haven't mentioned, but people can access those. And I think things like, speech pathology, occupational therapy, kind of figuring out a way to do that as well, we think is really, really key. I think just trying to reach more people, I think is really, really critical. Making sure that people know that we're here for them and we're reliable, I think is really key. As I mentioned, we truly do undersell ourselves for the most part, I would argue. And kind of that's probably going to be another point for us over the next year or so, is increasing the kind of selling of the company as best as possible. And then probably those partnerships with companies, I think is really key. I think, we've got some big players that we're already working with across the board, but, we're increasing those conversations, and not just with big companies either. That's great and helps everybody, helps company at the bottom line, all these sort of things. But, where we've been reaching out to kind of small organizations around community care access and things like that as well. So, one real key focus area for us, that would be great if we can get some of these setups going with conversations that we're having, is things like for people who don't have a home and they need to access healthcare of some sort through community services, where typically these community services might be, or whatever it might be, or similar services, and, providing kind of a chunk of time where we can just dedicate to, maybe it's a 2-hour time every day, or, twice weekly or something like that, where people can access us on demand in a community hub or wherever it might be. And then we can help them get access to scripts or whatever it might be if they need that. And that, we think that is, massive uplift to the community population. So, yeah.
I think there's quite a few initiatives there that in the end could come back to those points that you kind of, were really hammering home in terms of increasing the access of healthcare to more Australians. And if that means making the technology easier to utilize, or the platform easier to utilize, but also the covering the funding side, whether it be through those partnerships with employers or through other groups too, that's got to be a good thing in giving more people access to that care. So look, mate, we'll put the details for Updoc in the show notes of this episode, and of course got a good presence on the Talking HealthTech website as well, and all those jobs that you keep posting up on there too, so people can check that out. I really appreciate you making the time.
Nice one. Thanks, Pete. It's been great.
We hope you enjoyed this episode of Talking Health Tech. Make sure you like and subscribe, and share this episode with someone who might find it valuable. For more information and resources about healthcare innovation, visit talkinghealthtech.com.